Hi, my name is Alex, and today we're going to be discussing the degenerative diseases of the central nervous system. First, let's begin by talking about what exactly the central nervous system is. The central nervous system is composed of the brain and the spinal cord. Both of these parts work together in order to send signals to different parts of our body, controlling our thoughts, movements, and reactions. When looking for changes in brain matter due to these diseases, MRIs are usually the modality of choice along with CT and PET scans. Once a visual change is detected in the image, the doctor can now begin to correlate this visual image along with a specific pathology. The first disease we will be discussing today is Alzheimer's. Alzheimer's is an illness that deteriorates the brain gradually. It slowly demolishes a person's ability to think and remember. A person will eventually not recognize familiar faces or places. An MRI of a person with Alzheimer's disease will show a much smaller and weakened brain. Abnormal deposits of protein will show amyloid plaques as well. In the later stages of Alzheimer's, a person will require full attention and care. We need to be patient and empathetic when dealing with these patients as they may feel confused or uneasy. Although there is no known cure for Alzheimer's disease, doctors can help manage the different kinds of symptoms with immunization therapy, anxiety medication, or sleep aids. The image to your right is the brain affected by Alzheimer's. The next degenerative illness that we will be bringing attention to is Huntington's disease. In this situation, our chromosome number 4 is defective. A person will have unintentional movements as well as a severe decline in being able to rationalize, reason, or even properly speak. A patient with Huntington's disease will have temperamental changes that will eventually lead them to not be able to function in social settings. Huntington's disease affects the basal ganglia inside of the brain. An MRI will show loss of volume with diminishment of the neurons, including the caudate nucleus, putamen, and globus pallidus. It will also affect the cortex of the brain, which is responsible for the majority of our thinking. This is another disease that currently has no cure. Some of the symptoms can be managed by medication or by therapy. Unfortunately, this disease eventually can lead to death due to the patient's inability to be able to swallow food, drink liquids, and also slip and fall accidents because of the patient not being able to control their erratic movements. The image to your right is the one affected by Huntington's disease. The last degenerative disease of the central nervous system that we will be talking about today is Parkinson's disease. This is an idiopathic illness that progressively diminishes a patient's ability to have functioning gross motor skills and fine motor skills due to the damage to the brain cells that produce dopamine. A person with Parkinson's disease can typically be seen trembling profusely. Their balance is also affected. MRIs are not commonly used for Parkinson's diagnosis, as this modality only shows changes in the brain when a stroke has occurred. A PET scan, which stands for positron emission tomography, is better at showing the reducing amounts of dopamine within the brain. These PET scans look for the functioning of the brain as opposed to looking for anatomical and structural changes. Just like Alzheimer's and Huntington's, Parkinson's also has no cure. A common suggestion for patients with Parkinson's disease is a specifically designed medication taken in order to try and increase the levels of dopamine within the brain. The medication also tries to prevent the further decrease of the dopamine. It is important that we take extra safety precautions when we're dealing with patients that are suffering from Parkinson's or Alzheimer's disease, because these illnesses are associated with uncontrollable and unpredictable spasms of the body. Making sure that the area is secure in order to avoid a possible fall is top priority. The brain on the right is the brain affected by Parkinson's disease. In conclusion, there are different diseases that can affect the central nervous system. a person's physical and mental state will severely be affected. Doctors and researchers are continuously trying to find out what causes these changes in the brain and what can be done in order to either reverse or fix them. As a medical professional, it is imperative that we are patient and understanding so that we can provide the best care to these patients that are under our watch. In this picture, you will see the 4 main lobes of the brain: the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe.